Okay, ultrasound-guided IV cannulation, ultrasound-guided IV access. First things first, get the right probe. We select the right probe on here. We've got 3 probes on this one. That's usually for fast scans, that's usually for the cardiac. So when we're doing a CPR, we pause, we're looking for tamponade as one of the 4 T's in the context of cardiac arrest. That one fast scan, so AAA, hydronephrosis, renal calculi, and the likes of these kind of situations. This probe here, usually for IV access, and what we do is we'll put some gel on there, and what you find is as I put the gel on, you see on the screen, that's given us a shadow. I will then check the orientation on my probe. Okay, this by convention should be on the right hand side, so this side of the probe should be on the right to the patient or to the cephalic end. Once I've got the orientation, I then need to try to find a blood vessel. So a little bit of cold gel if I might. I've already applied the tourniquet, and here we go. We've got some vasculature in here. Now zoom in on this if you will please. So what I'm just going to point out is firstly there's a yellow arrow here. That reflects the middle of my probe over here. Not all probes have this, but it's a great little marker. Okay. Now you can see, if I just change the gain on this to make it a little bit brighter, you can see that little circle there. Yeah. If I go elsewhere as well, you'll see other circles here. These are all blood vessels. The question is this an artery or a vein? So on this one, in order to delineate between an artery and a vein, when you apply some compression, you find that an artery, some can collapse. Generally, textbook says that they cannot, but they can, as you can see evidently here, except you can see the pulsations here. Hence, this is your artery. If I go laterally, then you've got the other one here, and as I press down, there's no pulsations on this one. And therefore, this definitely is a vein. Okay, so we've got your vein. How deep is this vein? Well, that's the depth over here. That's 3 centimeters. So this one sits barely under the skin, is subcutaneous by about half a centimeter to 3/4. The next thing, as I said earlier, was to ensure that you've got the probe in the right orientation. Why? So if you look over here now, if you zoom out a little, as I move the probe up and down the patient's arm in this direction, which generally is, now you look on the screen, as I maintain that actually moves across. Okay, so I'll go back here near enough, and I go across, and it moves across as I go up. It's gone in that direction. What that tells me, if we come back onto the arm, is that the vein is anything but in that direction. Because I got the orientation, and on the screen it moves to that direction, that means as I go more proximal, the vein is moving towards this side of the probe. And as such, I can get the trajectory on my blood vessel. And now, if I move the probe in this direction, which is not directly straight, you'll see I can maintain the vein very much under the actual midpoint of my probe. So that's how I know the direction of my blood vessel, and that's what we refer to as trajectory. So therefore, I now know that the vein is running in that direction. The next thing to consider is at what point will I enter the actual skin. So personally, if you're now we're going to go up and down on this, because that's going deeper and more superficial. So as I've come further distal, that's deep, and as I come more proximal, you can see that becomes more superficial, albeit marginal, but it's important. And then once I pass the peak point, it goes deep again. And so when I go in, come back on the arm, when I go in with my cannula, if I enter at that point where it's deep and it's becoming superficial, the blood vessel is running in that direction. I'm going to go in that direction. So I'm actually going to intersect like that. Whereas at the peak, if I go from there, but then it's go deeper from the point of peak. So now if I go in with the cannula, I'm actually going to go in line and parallel to that blood vessel. So I'm going to have a much better chance of keeping the cannula in the vein. And that's precisely what I'm going to do here. So from here, I'm going to, from the more superficial point, I'm going to go from here, and that's going to be my point of entry about here. Just to point, as I come further away, you can see there's a bifurcation here. Okay, there's a branch coming off the vein here. So that would not be a good point of entry. Okay, so to go in, I've got sterile gel on here, so I'm quite satisfied we've got a sterile field. So now what we're going to do is point of entry and sharp scratch coming up, okay. Yeah, and I'm looking for, you can see on the screen, zoom in on the screen if you will please, and you can see that little white dot coming into play into the lumen, and that's well and truly in the lumen of the artery there. Yes, yeah. And I've got flashback quite nicely. I'm now going to show you that blood vessel and the actual cannula in this longitudinal plane. Once it comes in, there it is. So you can see right in the corner, I'm moving it here, and that's my cannula with the tip of my needle, and I'll just maintain that. So if I remove the needle there, and my cannula stays in the blood vessel well and truly, and there we are. There you have your IV access, and then I can continue the rest of the procedure from here. Thank you for watching.